We're talking to Mr. RCrowder, the founder of StreetWorks, and as well as an advocate of education for HIV and AIDS. And of course, Mr. Crowder, let's pick up where we left off the last time, trying to make a distinction between younger people who were impacted by this disease and perhaps older individuals who are impacted by this disease.
Okay, Dr. Haney, this is what's going on. Let me make it as crystal clear. What happens is, with the advent of new medications such as Viagra, Cialis, or in these other new medications, what is happening is, what we're seeing now is older men are seeking out, with this medication, younger women. Let me give you a good scenario. For example, you know, in what do they call it? Old high rises.
Okay.
For example, you got Mr. Bob who lives in the high rise.
Okay.
For
senior citizens.
Yes,
senior citizen
housing. There
senior
you
citizen
go.
housing, all those high.
Okay.
Yeah. Okay.
Now, Mr. Bob got Miss Lucy for a girlfriend. Now, around the first of the month, when Mr. Bob get that check, Mr. Bob get him some Viagra or some Cialis or whatever.
Okay.
Then he goes out of the high rise. Now, we're talking the first few days of the month, right? Then he meets up with Tamika, or the younger woman.
Okay.
On the streets. Yeah, you see what I'm saying? Now, because he got this extra staying power because of this medication, he feel he got this, you know what I'm saying?
I understand.
Then, from the 5th of the month to the end of the month, he goes back to the high rise, and then it's business as usual with Miss Lucy.
All right. Okay.
You understand what I'm saying? Now,
exactly
that's how that. And again, that's what we're seeing.
You're seeing
we're
that?
Seeing, yes, we're seeing that HIV is now in a whole new population of people. And this is just my opinion. There's been no research around this, so I couldn't definitively
But you see it every day, and you're working with it in that kind of situation.
This is let me say anecdotal information that I'm giving here. I wouldn't want to go on the record as saying this is definitive information. This is just my
just what you see, and after having worked with it for the last 20, 25 years, being intimately involved with it, you can make some kind of judgments in reference to it. Yeah, go on. Yeah, I understand.
But again, it's the stigma. Now, while HIV has become a manageable disease, there's still that stigma and that shame that was associated when HIV was first introduced. Homosexual, drug addicts, and these kind of things. So this kind of behavior associated with the disease, and the stigma and the shame and the guilt associated around being HIV infected is preventing people from going to take the HIV test. But we must realize that not taking the test does not change the fact if a person is HIV infected.
It doesn't change the status.
Right. It doesn't change the status at all. And my suggestion is everybody has an HIV status. The question is, do you know yours? And you should know yours. Because again, early detection and early treatment is the key to a successful, manageable disease. Not successful, let me say manageable disease. So that's